The San Diego Center for Children, like other essential services, is making adjustments during this pandemic.
It's now continuing its services via telehealth. Elizabeth Alvarez is live at the center in Linda Vista with the details of how they are continuing to serve. Good morning, Liz.
Hey, Liz.
Hi, good morning. Yes, Lauren, telehealth, just one of the ways, one of the changes that have been implemented. But to paint and give you an idea, the San Diego Center for Children, this is a place, a big campus. It has a residential program here. There is a school here. And then off campus, there are several programs that are implemented. Every single day, this center helps children and the families of children who are struggling with mental, emotional, and behavioral disorders. It has continued to do so amidst the coronavirus pandemic, but it has not been easy. They've been having to make a lot of changes. And this morning, I have the CEO and president of the center joining us. Dr. Moises Baron is here. Dr. Baron, thank you for allowing us to be here. Now that we are in the middle of this COVID-19 pandemic, tell us a little bit about how difficult this has been to transition and make all of these changes.
Absolutely. Thank you so much for being here this morning. So like you indicated, we have a 133-year history of providing a range of therapeutic and educational services to children with mental, emotional, and behavioral disorders. And that remains uninterrupted. We continue to do that. We had a plan in place knowing that this was likely to happen, and we were able to pivot very quickly to start providing services in a safe manner through telehealth. So in addition to our main campus where we're here today, where we have our non-public school and we have our residential program, we also have a range of therapeutic services in the community where we work in outpatient clinics, we work in pediatricians' offices, also we work in people's homes and in the community. And all of the services, we very quickly changed and pivot them to do telehealth. We were able to reach to our families and to be able to continue to provide services to them. So our team did an extraordinary job in being able to make that change, to be able to reach the families in need. And now we're also receiving new referrals because we understand that this is very difficult for families. Those that we were already working with, those that were already struggling to begin with, but this stress and these difficulties are really challenging our whole community.
And that leaves the need for perhaps volunteers to step up. Maybe there's our therapists out there that can do telehealth with some of the maybe prospective children.
So we're very fortunate that we have an extraordinary team, and they were very quick to adapt and to change. We were able to create the appropriate protocols. So our staff is working full gear providing those services. And right here on our main campus, we are providing still residential treatment services to youth that have the most challenging conditions and difficulties that require in-person treatment. So we have more than 35 youth here, and we are now receiving calls to be able to bring in more, and our staff comes to work every single day using the appropriate precautions and the appropriate approach to be able to continue to provide the therapeutic services that these youth require. So we take care of them 24/7, all the time, provide everything that they need, keeping them safe, and our staff has been nothing short of heroic, being able to continue to come here and work with them day in and day out. So we appreciate the acknowledgement of the community and also the support. We want to support our team, we want to support the youth that are here, and the community really can help us in a number of different ways because obviously this has been unprecedented and it has created a great deal of strain on our resources to continue to provide the services that we need.
Sure. So in order, help can come through monetary donations, volunteering, and more. Coming up in the next hour, Dr. Baron we're going to talk to him more about this residential program because although the staff here has adapted and quickly put into protocol the plan that it had in place, it hasn't been easy for a lot of the children. Lauren and Paul, San Diego, if you think about it, these are kids that are already having and struggling with these disorders. Change is not easy. And then the fact that they can't have parents come visit them or their guardians or their families, that just adds another layer of challenges and stress. So we're going to delve into that, and we're also going to talk about the school because the campus is closed. We're going to talk to Dr. Baron here in the next hour about how school continues on even though the campus here is closed. We're live this morning here in Linda Vista at the San Diego Center for Children. We'll have more details for you coming up in our next hour.
Thanks, Liz.
All right,